So now, in our time, the United Nations has established through the General Assembly with all 193 member states, adopted a set of 17 Sustainable Development Goals. We call them SDGs for short. And these goals have been built across many decades of work that the UN has done, with many nations collaborating in the UN context, to decide that there are a number of goals that the whole world needs us as people to work on to achieve, so that the world can be a healthier, more peaceful and prosperous place. It's all almost like a set of 17 recipes for a better world. And these goals are in place. They were put in place in 2015, and we're working on them and to see if how much of them we can achieve by 2030. And they run across so many fields of human life. There's a goal about economics and poverty. There's a goal about hunger and feeding people. There's a goal about health and well-being. There's a goal about education, and a goal about working on climate change, a goal that's working on women's rights and the rights of everyone. There's a goal working on peace and justice, and a goal working on water and sanitation, a goal working on employment, on sustainable cities. 17 goals. And the 17th goal is called Global Partnerships, a goal for improving how we work together as a world, as a humanity. Now, these goals are all very exciting and very interesting, but we were really happy to be seeing even earlier, when earlier goals were in place, the Millennium Development Goals, that Florence Nightingale was working on these same goals in her time. She was working on clean water and sanitation. She was working in London in a workhouse setting, helping people to no longer be impoverished and hungry. She was working on women's rights. She was working on education. She was even working on climate change. She was working with people in India because she was concerned that deforestation was eroding soil, that was changing weather patterns. In India, she was doing this in the 1870s. She was also working on peace and justice. She actually helped to craft the first document, the first international treaty in Geneva that set in place the Geneva Conventions that later led to the League of Nations and the United Nations. So she was working on all of these goals and calling it nursing, calling it health nursing. So we are very pleased to be advocating for achieving these goals and urging people to achieve these goals, and helping nurses to see that they're working on these goals, and helping everyone to see the value of the goals, the caring, concern, commitment, compassion that's needed to say, let's all work on these goals so we can have a better world. Nightingale said in 1870, she said, it will take 150 years before I will see the nursing, or we will see the nursing that I envision. 1870 plus 150, 2020, how amazing is that? We are coming to the time that she was envisioning that we could be doing the nursing and the caring and compassion that we need to be, and that everyone needs to be in 2020. Well, that's, as of this date, that's about 14 months from now. Wow. We get to live into what Nightingale envisioned for us now. Also, to say one more thing about Nightingale. She called her work her must. And when people said to her, well, why are you doing this? Or her family said, you should be paying more attention to us. When she had all of these diversions, these opportunities to do something other than her work, she said, no, my work is my must. And one of the things that we love to say in our time is to say to you, what is your must? She had her musts, and many of us have our musts. And to just be with that and say, well, what is my must? And trust that you will be shown what that is. If you've been shown already, just make another commitment to it as many days in your life as you can, because I'm guessing that your must is going to help make the world a better place too. And I urge you to say yes to your must like Nightingale did in her time.